Hi everyone, I'm Anaya Bangar. You might know me as a cricketer, influencer, and activist, like all three, like whatever you think would suit best. But yeah, I'm here today. I'm here for my surgery, which is the skin graft vaginoplasty that Dr. Chet is going to be doing with me.
Hi, good afternoon, Anaya.
Hi,
สวัสดี
Dr.
ค่ะ
Chet. So
Yeah.
nice to be here. So nice to be in WIH. It's lovely out here. Your team is wonderful. And I'm having such a blast here. I'm so excited for the surgery.
Yeah, so it's my pleasure, and
Yes.
I and my staff we are excited to
Yeah.
provide our good service for our best for your surgery, and of course the aftercare too.
To be honest, I've waited for this moment for the longest time. Since childhood, I had feelings of gender dysphoria and not being comfortable and fully aligned with my body. And 5 years prior, I remember in 2021, that's when I made the decision that I'm going to go through transitioning, and I couldn't think of anyone better but Dr. Chet. To be honest, it's kind of like the feeling of reaching to the thing that you always wanted to. It was always something that I wanted with me personally, and I'm just about to cross that barrier as well. So at the same time, I'm feeling very nervous, scared that I'm going to take this step. I don't know how the recovery is going to be. Is the recovery going to be painful? But at the same time, I know this is the right thing for me.
So we met one time
Yes.
consultation.
Yeah.
Okay, yesterday, and everything well planned.
Yeah.
After I took examination and confirmed that your skin and your material, everything is no problem for
Okay,
for
there are no
surgery.
issues with the surgical area, nothing like
Right,
that.
right,
Okay, perfect. And in terms of depth is a major thing that a lot of other trans women who might want to do this surgery, they would want to know that how much depth should we expect from this, how the aesthetic is going to be, how's the look of the surgical area going to be. So
Good
yeah.
questions. Normally, we want all elements
Yeah.
to get perfect.
Yes.
Yeah. So that means I emphasize on everything. So let me explain about the sensation
Yeah.
and the external look that you control with my signature technique, Dr. Chet's NPI.
Yes.
We dedicate the value skin, penile skin.
What is the full form of NPI for the viewers?
NPI stands for
Yes.
non-penile inversion.
Okay.
The concept is we don't use penile for invert,
Yeah.
for any vaginal lining. So we separate the look, external look,
Yeah.
apart from the inside of the function. Because if you use value skin being used for the vaginal lining,
Yes.
nobody seen, right? It's just a function. That means I think about this and develop NPI. Instead of we use the penile,
Right.
we switch to use entirely the scrotal.
Yes.
So scrotal skin graft work perfectly, but
Okay.
require a good technique to convert scrotal to be we call skin graft. Skin graft means hairless skin, because we're gonna to thin the scrotal to remove the subcutaneous fat and also some part of the mist that contain the hair follicles.
Okay.
That result the lining with skin inside the vagina completely hairless.
Wow.
See, yeah.
Science has come way too far.
Okay. That concept is very important because that means I have the freedom to use penile skin for entirely work outside, focus on inner labia and vaginal opening. Inner labia and vaginal opening is the answer for modern aesthetic concept.
Yes.
Because we want the look of those parts to be real, like a cis female.
Are there any remedies or any pre-op measures? Like you mentioned, there's
Yep.
hair down there. Would you recommend getting laser hair removal done prior to this? Is it needed, or can it be kept as an optional?
Yeah, good
eventually?
questions. We're going to focus on the area first.
Yeah.
Because as I mentioned, scrotal, when I use inside for lining, I can get rid of, remove the hair follicles during surgery. So that means you have no need to do any hair removal procedure before surgery on the scrotal. What the exact location that I want is just we call perineum area.
Okay.
Perineum is the area that between your anus, above the anus and the base of the scrotum. Because we use that skin, perineum skin, for construct the floor of the vaginal opening. So if you still have some hair may be appear around the opening, but not inside the canal. But you can access that area for hair removal later.
You can leave it for later as well.
Yes,
Got it.
that's correct.